Hello and welcome to this presentation. My name is Abel from Anmok Technologies. And today I'll be taking you through a quick but thorough walkthrough of MedicentreV3 HMIS. This demo is designed for healthcare facilities who are looking to streamline their operations, seal revenue leakage, and at the end of the day, improve patient outcomes with a reliable hospital management system. By the end of the session, you'll get to understand how MedicentreV3 will handle patient registration, billing, inpatient, inventory management, reporting, and how we aim to onboard your team should you decide to take on the system. I will be sharing my screen and walking you step by step through the system, while also highlighting key workflows and best practices along the way. If you have struggled with chaotic patient queues, revenue leakage, stock losses, unreliable reporting, and even constant system downtimes, then I'm sure you're going to like what you see. So stick around till the end of the session for details on how to get started or book a personalized session with our team. Let's dive in. To get started, open your preferred web browser. MedicentreV3 works smoothly on any web browser that you may be using, whether it's Chrome, Microsoft Edge, Firefox, and any other modern browser. So whichever you're comfortable with. Proceed to the address bar and search for MedicentreV3. Okay, so it's going to give you a list of options to select from. Or if you just type in MedicentreV3, it's going to bring you here to the Google page where you're going to select the first option, MedicentreV3 login. So it will redirect you to the login page, whereby you're going to be asked for the facility access code. So this code is usually unique. You're going to assign it to you after you have already been onboarded so that you can be able to access your facility's instance. For demonstration purposes, I'll be using the demo. So you just type it in small letters, okay, because this is case sensitive. You can save the code so that you don't keep on doing this over and over again, and then you can proceed. Okay, so up here it will list the name of your facility. If you're a facility with multiple branches, then the system is able to incorporate all of the branches here, so you're able to select which branch you wish to access. Each of the users will also be assigned a username and a password. Okay, so they're just going to enter their username and their password, and they're going to log in. So this is how the system looks like. On my left, we have the modules, and on my right, we have the panel. For the modules, these are the features or the modules that you'll have selected from the pricing app. Okay. From the panel, we have the shortcuts here, whereby if I'm a receptionist, then I can just decide to have the registry shortcuts. If I'm a doctor, I can just decide to have the doctor shortcuts. Essentially, it just helps you to navigate to your panel easily instead of following the long process. Okay. In the My Appointments section, you're able to see all the appointments that you have for the day. In the to-do list, then you can be able to enter something. Okay, enter something that you wish to do for the day. And then at the bottom right, we have the chat. In the chat, you're able to send private messages between users. You'll be able to see all the users that have logged in, so you can be able to send messages to each other, which is confidential. Not even your administrator can be able to see it. At the top right, we have the queue. In the queue, you'll be able to see multiple patients who have been queued to different rooms and the total number of minutes that they have stayed in each room. We also have a section of room here, which has to be correct for every user, because whenever a patient is queued to a room, you have to be signed in to the correct room so as to be able to see that particular patient. So for the purposes of this demonstration, you'll be seeing me changing rooms from time to time because I'll be operating multiple roles at the same time. In the branch area, if you're a facility with multiple branches, then you can be able to easily switch between branches. Okay. So let me begin with the clinical module. So we have the registry here. So if I'm a receptionist, I can click the registry here, or I can just come and click the registry shortcut here. So either will do. So it will redirect you to the registry panel. From this panel, as you can see, it's very comprehensive, and it has captured everything that you may need to know about a particular patient, such as the name of the patient, the ID number, the telephone number, the occupation of this particular patient, where do they live, and of course the details of the next of kin. Alright. From the same panel, the receptionist is also able to search for revisiting patients. Okay. It's essential for the receptionist to always search for a patient before registering, because we want to avoid cases of duplication of patients in the system. At the bottom right, we have the customer schemes, where you can see in green. From here, the receptionist is able to assign any insurance scheme to a patient. Okay, depending on which insurance schemes you are allowed to cover as a facility. Okay, so all of that will be configured here, and of course this will be configured according to what you have as a facility. So to emphasize some of these fields, as you can see, some have asterisks, meaning that they are they're compulsory and they have to be filled. Fields such as the names of the patient. Patients may have 2 names, patients may have 3 names. We usually recommend for the receptionist to cover all 3 names, because patients may have similar 2 names. So if possible, register the patient with the 3 names if they have it, the gender of the patient, the date of birth, the ID type, which is very crucial, because this is a unique identifier that distinguishes between patient A and patient B. Okay, if a patient comes in, they have to be assigned a unique ID. Do they have a national ID? Do they have a birth certificate? Do they have a passport? So any will do. Okay, the telephone number of the patient. Okay, the residence where they live, the occupation, the next of kin details, the nationality of the patient, and all of that. Okay. For purposes of this demonstration, allow me to search for a revisiting patient. Let's say Abel. So the system will show me all the Abels, or any name that has the word Abel in it. So to narrow down the list, then you can just enter probably 2 names, or you can even enter the telephone number of the patient. You can even indicate the ID number of the patient, the outpatient number, should you be able to remember it, the membership number of the insurance card, and so on. So let me select any patient, Mary. So as you can see, I can see all the details here. Okay, these are all the details that were captured last time. And of course, you can be able to see that this patient has an outpatient number, which is automatically assigned by the system. The registration number, which indicates when this patient was registered, and of course the insurance scheme that this patient has. If you want to assign more insurance schemes for this particular patient, then you can be able to add from here. Alright, just indicate the insurance scheme, indicate the membership number from here, and indicate whether this patient is the principal member, meaning that they're the ones who paid for the card, or if they're not the one who paid for the card, then you can indicate the name of the principal member here. So but just by ticking, it picks the name automatically from the registry side, and then you can proceed to save. Okay. Afterwards, you're going to see that insurance scheme has been added to the patient visit. Okay. Afterwards, you can update the changes and proceed to queue the patient to the next room. So this is how the queue panel looks like. Okay. It will indicate all the demographics of the patient, such as their name and the age and the outpatient number. From here, the receptionist will see from reception, so you're not going to change this, to probably to the billing office. if it's a cash payer. Okay, if it's a cash payer, you can proceed to queue the patient to billing so that you receive the consultation fee, okay, before the patient is queued to the triage. But if I want to use, let's assume that my patient is an insurance patient, then I can proceed to queue the patient directly to triage. Okay, and then you can select the clinic that this patient has come to attend. Is it family planning? Is this patient just a general patient? Has the patient come for oncology, physiotherapy? So you can be able to specify. This one is also very important because at the end of the day, the administration will need to sit down and see how many patients came to a certain clinic. Okay, so this also has to be correctly captured. And from here, the receptionist can select which insurance scheme will be catering for all the services or all the drugs that will be provided or prescribed to this particular patient. Which insurance scheme will be used as the default scheme. So I can select, let's say, SHIF. Okay. There are also other aspects that you can see from this panel. We have the print queue ticket, which works almost similar to the one in the bank, whereby once you enter the bank, you are given a ticket. Okay, and the teller, of course, is going to call on that ticket. So it works similar. When you enter the once you're registered, when you enter the facility and you're registered, the queue ticket can be printed by the receptionist and given to the patient. So as you can see, this is a checkbox whether you want to print it or not. If you want to print it, then the system will generate a ticket number. If you leave it unchecked, then the system won't generate a receipt, or it won't generate a ticket. We have the is emergency option. So let's say a patient comes in and 50 patients had already come previously and they were queued to triage. If I take this patient as an emergency case, this patient should automatically go to the top of the queue in the triage panel, and will appear in a different color coding. Okay, and of course you can take it is revisit if it's a revisiting patient. Okay, and of course in the note section you can be able to indicate any note that you want. It's not compulsory, but if you wish, you can indicate something that the nurse on the other end will be able to see. Okay, so let's queue the patient. So you're going to get a notification that the customer has been queued successfully. All right, so let me now assume the role of a nurse. I'm going to come on the triage section here, the triage panel. So this is how it looks like. All right, from here I am going to select the room. I'm going to select my room, triage. This one is very important because it will enable you to see all the patients that have been queued to your room. So the first thing that you'll see is what we call the mini queue. You'll be able to see patients that have been queued to your room, from which room they were queued, and the total number of minutes that they have stayed in your room. The queue is arranged in first come, first serve basis, meaning that the nurse has to start with the first patient before proceeding to the next patient. All right. Once you select your patient, you'll be able to see the demographics that were captured from the registry side. Okay, you can be able to see the insurance scheme that particular patient is using. You can even be able to see a note if it was indicated by the receptionist. Okay, so you're going to select your patient. Mine was Mary. And then you're going to start taking the vitals. If it's temperature, you indicate the remark there, probably 36 degrees, you save. The blood pressure, you indicate it there, 120 over 95. The weight of the patient in kgs, so let's say mine is 65 kgs. and of course the height of the patient, which is in meters. So let's say mine is 1.4 meters, and then you save. Okay, so what you'll notice is the different color coding. Vitals that appear in red means that these are abnormal. Okay, they're abnormal because they are below or above a certain range, and they shouldn't be like this. Okay, once you enter the weight and the height, the system should automatically calculate for you the BMI and the BSA. Okay, so which also appear to be abnormal. Okay, so such indications may now make the nurse feel that this probably is an emergency case and needs to be attended very quickly. Okay, so that's what we're going to capture on next. To touch also on the procedures field, so this field will show all the procedures that you do as a facility. So if you enter any procedure here from this drop down field, it should automatically appear on the billing side. The importance of this is because the system aims to seal revenue leakage. So that means for every procedure that you do, you should be able to capture it very easily without necessarily having to go to the billing section or having to tell the cashier to enter something on the bill. The nurse can be able to do it for herself. And of course, as you can see, she can also be able to indicate the nursing notes from here and save the notes. Okay. The next thing that the nurse will do from the triage section is queue the patient. So on the Actions tab, the nurse will be able to queue the patient to the next room. Okay, so let's say it's consultation room. And then after her assessment, then they can decide if this is an emergency case, then they can take its emergency and queue the patient. So what you'll notice is the patient will disappear from the triage mini queue. So now let's assume the role of a doctor. The doctor can access the panel through the doctor's shortcut or through clinical doctor. Okay, and as you can see, they have been arranged in a systematic order that is very easy to follow. Of course, my room will be consultation room. So depending on how many consultation rooms that you have, we'll be able to configure these rooms. Okay, whether you have 2 consultation rooms, if you have 3, it doesn't matter. And then I'm going to sign in. So what you will notice is these are all the patients that have been queued to consultation room 1. And of course, these are the rooms from where they were queued and the total number of minutes that they have stayed in that room. Okay, so as you can see, Mary is appearing in red because we had already ticked her as an emergency case. So that means that she takes priority over Humphrey. Ideally, the doctor should have started with Humphrey, who came first, but because Mary is an emergency case, then the doctor has to start with Mary. So the doctor will select Mary from the mini queue. Okay, from there, the doctor will be able to see all the demographics that were captured from the registry side, as well as the vitals that were captured from the triage side. Okay, from here, the doctor will start taking the complaints, the HPI, the medical history, surgical history, family history, and all of this information. All of them are very important information for the doctor. So if it's complaints, you can indicate it there. Probably the patient came in with a headache. You save, and any other complaint, you can be able to save it from here. Okay, you can indicate the HPI and save the information. You can indicate the medical history and save the information. Okay, so let's say patient has history of hypertension, and then you save, and any other information that you need to save as a doctor or as a clinician. Okay, at the bottom you'll be able to see all the patient's previous visits. Okay, you can be able to click on their report and it will show what exactly was captured the last time that this patient was here and which doctor captured it. Okay, whether it's a prescription that they were given, whether it's any procedure that was done, it should capture on each report. Okay, and of course if you want to view a consolidated patient visits report, then that can also be seen from here. Okay, so I will write all of this information, and then in the impressions field, which is also important, I can indicate what I think might be affecting the patient, and of course this can be as many as possible. Okay, you can indicate as many impressions as possible. And what about if this particular scenario demands for a lab test? Then a lab test will have to be requested for. So on the Actions tab, you can see all of this all of these options available for the doctor to choose from, whether it's referring of patients, whether it's writing of physical examinations, lab request. So once you make a lab request, you can be able to select the test that you wish to be done. Okay, so the system should show you how much that particular service that particular service costs under that particular insurance scheme. So this helps because you may find that you want to set different prices for different services for different insurance schemes. So you may find that the price for cash may be different for the price for SHA or the price for Makael. So you can also be able to set different prices for different services or different drugs. The doctor also has a leeway of selecting which insurance scheme they would like to cover for a particular lab test. Okay, so let's just say I want mine to be captured under shift, so I save. Okay, and I can select as many tests as I want. If probably I want BS for malaria, you can also proceed to save, and any other. Okay, so by capturing all of these lab tests, they automatically appear on the billing side. Okay, but I want you to remember that because my patient is an insurance patient, I do not necessarily have to queue the patient to billing because it's an insurance patient. But if it were a cash payer, then I was supposed to queue the patient to billing. But because mine is an insurance patient, I'm going to proceed to queue mine to lab. And the patient will automatically disappear from the doctor's queue. So let's assume the role of a lab tech. We have the laboratory module here, and of course their room will be lab. Okay, so the lab tech will get a notification that a patient has been queued to your room. Upon checking, they're going to see Mary Isabella dummy. They're going to select the patient, and then they're going to see the tests that were requested for. Okay, now let's assume I'm a doctor and I had mistakenly queued the patient to lab, and yet the patient is a cash payer. The lab tech will be able to see the patient, but won't be able to see the requested tests. Okay, that's because they have not been paid for. But because mine is an insurance patient, they're able to see the service even without an invoice being generated. Okay, so the lab tech will proceed to select the test that they want to perform or do tests on. Okay, so each test has its own panel, as you can see, which will be different from any other. So for full hemogram, you may find some have ranges, some do not have ranges. So the lab tech will proceed to select the lab test that they want to do tests on. Okay, and then proceed to do the sample collection and enter the turnaround time. Probably how many minutes do they think the test will come out, and of course you can indicate the specimen condition from there, and then the tag. Probably you can indicate the name of the patient, and then you save. Okay, after doing the sample collection, of course you are now going to wait for the tests to come back, after which you're now going to fill this panel. So probably falciparum, you can indicate the number of parasites that you have seen for that particular test component. Okay, and of course after indicating the number of parasites here, you can even indicate the result, whether it's seen or not seen. Okay, so you can do this. If probably you want to redo something, you can be able to clear and redo. Okay, after you're done with that particular test, then you can proceed to the next one. Okay, so let's say for hemogram, you'll start with the sample collection, where you'll be able to indicate everything that you need to indicate from here. Okay, and then the tag, after which now you're going to fill in these values. Okay, so probably white blood cells, you have found it's 3.8, so you can indicate 3.8. So the system will know that this is a normal result because it falls within a certain range. Probably RBC, granulocytes, anything that you need to fill. So the doctor will only be able to see what the lab tech has filled. Okay, so if the lab tech has only filled for white blood cells for full hemogram alone, then the lab tech won't be able to, the doctor, upon reviewing the patient's lab report, won't be able to see the others because they were not filled by the lab tech. So it's very important for everything to be done in a correct manner. Okay, so the system will automatically pick some of these results after you enter the value, especially for test components that have ranges. Okay, so after this has been done, there are some approval levels that are in the lab. The lab results will have to be approved. Okay, and after approval, they will have to be submitted. Okay, so it will open this panel where now I can be able to queue the patient back to the doctor, and the patient will disappear from my list, from my queue. Okay, now for the doctor, they don't know what's happening in the lab area, but they will get a notification that a patient has been queued to their room. So let me go back to the doctor's module. I have to be signed into the correct room. I'm going to select my patient, and then I'm going to review the lab reports. Okay, I'm going to review the lab report, everything that was indicated by the lab tech, and then after reviewing it carefully, then I'm going to enter the diagnosis. Okay, so the diagnosis uses ICD-11 coding. So for instance, if I write malaria, the system should give me a list of all the ICD codes that have malaria. Okay, so let's say mine is malaria due to Plasmodium falciparum, and then I save. You can enter as many diagnoses as possible. Okay, it doesn't necessarily have to be one, and if you want probably to delete, you can be able to delete from here. After giving the diagnosis, then the doctor will have to give a prescription. Okay, so from here you can see a list of options: drug, non-stock, procedures, supplements, and optical. For drug, it will pick automatically from the storage locations that are in your facility. So the default one being pharmacy, and then you're going to select the name of the drug that you want to give out. Probably you want to give out Coartem. So the system will show you the batch that is available. Okay. Another thing that I may need to point out is if a drug is out of stock, it won't appear on this list. If a drug has expired, it also won't appear on this list. So the pharmacist and the stock and the procurement officer have to make sure that everything that is indicated in the inventory panel is correct, so as not to inconvenience the clinical team. So you're going to enter the drug that you want to give. The system will show you the total number of tablets or pieces or boxes, depending on the unit of measure that you had put, that you currently have. Okay, and of course even the price, how much are you selling per tablet or per piece. Okay, and then you're going to enter the dosage instruction. Take 2 tablets 3 times a day for the next 3 days, and the system should calculate for you the total quantity that will be reduced from stock after you click the save button. Okay, so that's how you save a prescription. You can indicate as many drugs as you wish from this list. And let's assume that probably you have a drug that's not in this list. What do? Probably the drug is out of stock and the patient has to be given that drug. Then we have the non-stock option, where you can indicate the name of the drug, and then you give the dosage instruction and you save. Okay, so this will this you can be able to print it from the non-stock report, sign it and give it to the patient so that they can go to a nearby pharmacy to procure or to buy. So let's just do an example of paracetamol, and then you give your dosage instruction there. Take 2 tablets 2 times a day for 3 days, and then you save. Okay, so for paracetamol it won't appear on the bill because it's a drug that you don't have. Okay, but you can print the non-stock report. Okay, you can be able to print it and sign it and give it to the patient so that they can go to buy elsewhere. Okay, so after the doctor has already indicated the prescription, then the doctor will proceed to queue the patient back to the billing office. Some may ask why the billing office and not the pharmacy. This is because the pharmacy is the last point or the end point in the system, meaning that the pharmacist won't be able to prescribe drugs, won't be able to dispense those drugs to a patient if they have not been billed. That means if an invoice has not been generated or a receipt has not been generated. So it's very important that they pass through the billing side first before they proceed to the pharmacy side. So billing office, and then you queue the patients, and now you can proceed with the other patients as a doctor. Okay, for the billing team, they won't access the clinical module but rather the billing module, and then patient bills. Okay, and of course from here the room will have to be correct, billing. From here they'll be able to see all patients that have come today and who have pending bills. Okay, all of their names will be listed down here, so they can just proceed to open a patient's bill by double clicking on the patient's bill. So this is how the billing panel looks like. So you're able to see a lot of details from here, such as the insurance scheme that this patient is using as the default scheme, probably the occupation and the age of the patient, the name of the patient, and once you scroll down you'll be able to see the bill items. Okay, so this is what's of most interest to the cashier or the billing officer. From here they'll be able to see all the services and all the drugs that were prescribed to this particular patient. Okay, they'll also be able to see the insurance scheme that is covering for each particular product or service. The payment, all of them as you can see are still pending, meaning that we have not received payment yet. Dispensed means that they have already been done. the total quantity for each particular product or service, the rate per product, and then the total amount at the farthest right. At the bottom we have the different color codes that you can see here. So black means that they are pending payment. Green, normally for cash payers, means that once we generate a receipt, then they will all turn to green. When we generate an invoice, what we're about to do in a moment, they will turn to yellow. If a service or a product has been dispensed or given or done, then they will turn to blue. And if I were to delete or void something in the bill, then that particular product will turn to red. Okay. After understanding those facts, then I can proceed to generate an invoice for this particular patient. So you just select the items. Okay. In the type of sale here, you can see on the drop down you have multiple options. You have cash sale, credit, partial payments, offset from deposit. So let's say mine is credit sale because this is it's an insurance payer. And then I'm going to create an invoice, and then I am going to indicate the claim ID here. Okay, so you can indicate it from here. So the one that you can see, the one that's appearing in red, this one means that we had created an invoice but we had deleted it. So that's why it's appearing here. Okay, so for this new invoice I'm going to save it, and it's going to create a separate invoice. Okay, this is how the invoice looks like. Okay, from here you're even able to enter your stamp. Yeah, so you can have electronic stamps, digital stamps, instead of generating the reports or printing the report before you stamp it manually. You can just have a digital stamp in the system that will automatically append. It will show the billing officer who generated this invoice, and of course this is the whole format now. You can even be able to print it and give it to the patient for signing. All right, so let's say how the bill items have changed since we generated the invoice. As you can see, some items have turned to yellow. Okay, others are still in blue, meaning that they were already done, they were dispensed. So even if this item was to be dispensed by the pharmacist, you'll be able to notice that it will change to blue itself. All right, so the billing officer will proceed to queue the patient from billing to pharmacy. And then proceed to queue the patient. All right, and then the pharmacist on their end, they're going to access the billing module as well, billing, pharmacy, and their room should be correctly indicated as pharmacy so that they'll be able to see all the patients that have been queued to their room. They're going to select the patient, okay, and they are going to be able to see all the drugs that were prescribed by the doctor. Okay, should they wish to view the visit summary of everything that the doctor had indicated, they can be able to see it from their panel very easily. Okay, if they want to change the patient's prescription, should they have the privilege to do so, they can also change the prescription or even add another drug from the list. Okay, but essentially, ideally what they're supposed to do is just select the drug and then mark or dispense and finalize so that the patient is removed from the queue completely. So you dispense and you finalize. Okay, so that's the whole outpatient process in a nutshell. So in the next video I'll be covering the inpatient module and how it works before I move on to maternity and dialysis. Having already taken you through the outpatient workflow and what it entails, I would now like to shift focus to the inpatient module and what makes it different from other systems that are out there. So, in the MedicentreV system, there are three ways in which a patient can be admitted. A patient can be admitted through the normal outpatient process, through the doctor's module. A patient can be admitted from the inpatient module, and a patient can be admitted from the maternity module. Okay, so to access the inpatient module, you can either click on the shortcut or you can come to clinical inpatient. From here, the first thing that you will interact with or that you will see is all the patients that are currently in admission. Okay, you'll be able to see the inpatient number, which is system generated, the outpatient number, the name of the patient, when they were admitted, the total number of days that they have stayed in the ward, the ward and the bed number they currently occupy, the insurance scheme that's covering for all their services and all the charges, as well as the total bill accumulated so far. Upon selection of a patient, you'll be able to see extra details such as the rate per day for the bed, who admitted the patient, okay, and of course other details, even the admission date and time, and the total number of days that they have spent. On the Actions tab, we have a variety of features. For the nurses or the persons who are going to receive this patient in the ward, we have the admission summary, which should capture everything that the doctor had indicated from the outpatient stage. Okay, and of course we have now the drug administration chart, or as most clinicians call it, the T-sheet. Now for this T-sheet, it will enable the correct flow of drugs from one point to another, with an aim of ensuring that you do not lose your stock along the way. There are three people who will be able to access this particular feature. We have the doctor, who will be able to indicate the drug that they want prescribed. Then we have the pharmacist, who will be able to dispense this drug, and we have the nurse, who will be able to administer this drug. Okay, so for the doctor, they'll just have to indicate which drug they want to give. Okay, the route, the strength of the drug, indicate if it's a start dose, okay, by ticking on this button here, the quantity at a time. Okay, for instance, for this particular drug, its dosage unit is drops, so probably one drop, how many times a day, for how many days. The system will calculate the total quantity that will be reduced from stock. Okay, and the drug will automatically appear down here. Okay, after 7. For the nurse, they're going to select the drug, and of course they're going to see the times that this drug is supposed to be given. If probably they have not understood the instruction here, they can be able to view the drug administration report, which has extra details listed, okay, such as the strength and the route of the drug. Okay, so what you can notice is we have different color coding also in the drug administration chart. We have blue, we have black, and we have green. Black means that it hasn't been administered yet and it has not been dispensed. Okay, blue means it has already been dispensed by the pharmacist. It's only upon dispensing that this particular item will go to the patient's bill. All right, so the nurse of course goes to the pharmacy, says I want these drugs for this particular patient. The pharmacist, because they will also be able to access the T-sheet, will be able to see all the drugs that have been indicated by the doctor, select the drugs that they want to dispense, even if it's for a certain day. Okay, select them, and then they're going to bill and dispense. For the nurse, what they're going to do, because the doctor said that this drug should be given at 3 p.m., they're going to come to that drug, right click on it, and then administer that drug and indicate at what time this drug was administered. Of course, they have the option to even backdate the time should they wish, and then they mark. Okay, so the system should show the name of the nurse who administered that drug. It will pick automatically from their usernames that they are using, or the username of the computer that they're using to access this particular T-sheet. All right. Furthermore, we have the inpatient charts. Okay, this is what distinguishes and separates MedicentreV3 from any other system that you have interacted with. We have all the inpatient charts here, whether it's the general observation chart, of course, for capturing vitals while the patient is in the ward, the neurological observation chart, okay, the admission nursing cardex, the comprehensive fluid assessment, fluid intake output chart, and a variety of other charts. Okay, and even if you have a theater, we have the theater preoperative checklist that is very comprehensive, and that will have to be done by the nurse, by the ward nurse, before the patient goes to theater. Okay, just to have a look at some of the charts. So here is it. We have the general observation chart. Of course, you're going to indicate your vitals, you're going to save, and the system will generate for you a visual chart of how the patient is progressing. Okay, as you continue to add these observations and saving, the system will continue to update the chart by itself, as well as all other charts. We have the continuation notes for the doctor who's of course doing ward rounds, and in the morning or at any time. Of course, the doctor can be able to indicate a note, the doctor's order, if probably they've done any examination, and then the name of the doctor before they save. All doctors who attend to this patient will have to indicate their notes from the continuation notes. The system will generate a very comprehensive continuation report. Okay, for doctors as well, they do not have the option to backdate the continuation notes. This is because we do not want anything to happen to the patient and then they start manipulating the system. The system is supposed to safeguard against that. We have the nursing notes. For the nursing notes, this will be used by all the nurses who attend to this patient. For them, they have the leeway of changing the time because, of course, we understand the busy nature of nurses in any facility. So, of course, you indicate the name of the nurse and you indicate your notes, and then you save. The system will generate for you a very comprehensive nursing report. We have the nursing care plan. Do you have some guidelines of what you will do or what you will use to attend to this particular patient? Then you can indicate it there, and then you save. This will also generate for you a very comprehensive nursing care plan report. Okay. For bed transfers, do you wish to transfer the patient from one bed to another? You can be able to do that, and of course you have to give a reason as to why this has to be done. Okay, so the system will automatically do that by itself, make the transfer. If you want to make a lab request or a radiology examination request or a theater request directly from the inpatient module, that can also be done from here. Okay, so you just make a request and indicate which test would you like to be done. So of course, upon saving, this particular test will reflect on the patient's bill. Okay, it will reflect on the patient's bill, and it will automatically appear on the lab panel or on the radiology panel, because of course you cannot queue a patient who has been admitted. So for the lab tech or radiologist, they're able to see the requests directly from their panel, even without queuing the patient. Okay, if probably you want to access the patient's bill, you can just access the patient's bill from here. If you want to make a referral to another facility, you can be able to refer a patient. the discharge summary. This one is very important and very mandatory, meaning that a patient cannot be discharged without the discharge summary. So it has to be very comprehensive. Every detail has to be well captured, so as also to avoid cases of claim rejections by your various insurance providers. If probably you want to adjust the admission date and time, you can do that. And of course, files. If you want to upload a manual document against a patient, you can be able to do that from here and upload. Okay, whether it's a scan, whether it's a manual document, whether it's a manual referral document, all of that can be done from there. And of course, what sets us apart as well is the inpatient file. So, as a company, as an institution, we aim to reduce paperwork as much as possible for any facility. So, we understand that so many facilities currently, as much as they do have systems, most of the inpatient notes are being taken manually and being put on a file. Something, of course, that we want to eliminate completely. So the system allows you to indicate your notes in the system. Okay, indicate everything that you have about that particular patient, and at the end of the visit or upon discharging, and you wish to have all of that information into a single file so that you can put it in a manual file, then it's still fine. You can be able to tell the system, I want this report generated. Okay, and then you can generate the file. So the system will generate the file in PDF that you can be able to print and put in a manual file if that's what you want. Okay. For generation of gate passes, of course, this can only be done if a patient has already been discharged. So, of course, we have a filter here. Okay, if a patient has been discharged alive, dead, absconded. Okay, so all of that will be indicated upon discharging. Is the patient discharged alive, dead, absconded? The name of the discharging doctor before you make the discharge. Okay. So that's the inpatient module in a nutshell. Now let's move into one of the most important clinical areas in any hospital, the maternity module. So this section of MedicentreV3 is built to support the entire journey of an expectant mother, from antenatal visits all the way to delivery and postnatal care. Okay. So to access the maternity module, just come to maternity, and this is how the panel looks like. Okay, from here you are able to create a maternal profile. Okay, let's say it's a mother who has just come in and is expected to deliver soon. Of course, they will have to be registered, and of course from here you're able to select the mother. Of course, she has to be female. Enter the LMP, the EMP, okay, the gravita, the parity, marital status, education background, and then you're going to create the profile. Okay, so once you create the profile, the mother will be listed under pending delivery. Okay, here you're able to select the soon-to-be mother. On the Actions tab, we have a lot of details that need to be captured. Of course, whether it's the antenatal profile, that will be captured from here, and the information will be saved. For the patient vitals, they'll have to be recorded and saved as well. When it comes to the medical and surgical history, they have to be indicated clearly and saved. And of course, we have the admit from profile. If you like this mother to be admitted and also be seen from the inpatient module, then you can be able to select the ward, the bed number, and the doctor who is admitting this mother, and then you admit. So this mother will also be visible under the inpatient module, from where if you want to indicate your nursing notes, if you want to indicate any prescriptions, that can be done from there. For the maternity module, it's just for recording the labor pathographs, deliveries, immunizations. Okay, so for the labor pathograph, for instance, when you start with the fetal heart rate, you're just going to give a figure. Of course, after testing the mother, after examining the mother, of course, these details can easily be captured by the nurse. Just indicate the heart rate of the child from here. Okay, once you indicate, you save. You will notice after you continue to save, the system will continue to generate the diagram by itself, the pathograph by itself. The fetal membrane, you have a drop down list here from which you're able to select from, and you save. It will continue to update this pathograph. The fetal molding, the cervical dilatation. Of course, we do understand that there's some vitals that usually take 30 minutes after, others you take with intervals of 4 hours. So you just have to be correct in the timing. Okay, the system allows you to backdate if need be, so that to ensure that your pathograph appears very comprehensively and very well. You also have the option to print the pathograph should you wish. Okay, it will generate for your pathograph in PDF format. We have the delivery option. So for the delivery, of course, here you're able to record delivery if it's C-section, if it's vaginal delivery, vacuum extraction, and any other. Okay, indicate the date and the time, the place, and you can specify the place. Conducted by the nurse or the doctor, you can specify, and then you can also enter the name. Okay, so let's just do it. Healthcare facility, Handmark Dummy Hospital. And then conducted by nurse John Dummy. The total blood loss can be indicated from here, and then the mother's condition, stable. And then if you have done any resuscitation, then you can take this. If not, you can leave it. Once you save, the system will generate another window whereby you're able to enter the names of the newborn. Okay, probably you don't know the names of the newborn, so you can just give them the name of the mother, and then you write baby. Okay, baby Marcella, baby Anne. Okay, so you can just indicate it there, and then you save. You can indicate as many newborns as possible. So as you continue to save, after you are done, you should also save the delivery. Okay, so that's for recording deliveries. And of course, when the mother comes back for immunizations, you'll have to choose from the now delivered mothers. Just select the mother, actions, immunization. From here, the system will automatically pick the names of the child, okay, of the newborn child, and then of course the system will show you all the immunizations that you're supposed to give. So of course this will be configured according to the drugs that you have at your facility, so that whenever a drug is administered, this drug is automatically reduced from stock. Okay, afterwards you are going to update the immunization, and the system will generate for you a very comprehensive immunization report. Okay, and then we have the development milestones, which will also have to be configured at your facility. So the system will automatically pick the name of the child, so you can indicate that for this child they are able to latch onto the nipples. Of course, this is the time range, so at what age did this child achieve this, and then you save. As you continue to save all of this, of course the system will generate for you a very comprehensive development milestones report. Okay, if you wish to give a prescription to the mother, you can also give a prescription to the mother from here. Alright, if you want to probably to deactivate the profile, you can also be able to do that from here. if you want to see a profile summary of everything at a glance, of everything that has been indicated about this mother, then the system will also generate for you that report. Okay, yeah, so that's the maternity module in a nutshell. Let's now take a look at the dialysis module in MedicentreV3. So this module was designed specifically for facilities who are offering renal services, and it helps clinicians to track dialysis sessions accurately, while also ensuring that all your consumables and medications are accounted for. So to access the dialysis module, just come to the dialysis and then dialysis orders. From here, you'll be able to see all the pending orders, okay, or the dialysis orders that are still pending or have not been completed yet. Okay, but of course you have the choice of seeing all the ones that were completed or all the ones that were cancelled, but by just giving a time frame and then you view. You proceed to select the patient that you like to see the treatment order for. Select the patient, and then on the actions you're able to do a lot. When it comes to the dialysis observations, you can be able to indicate the important notes from here. Okay, you can also be able to capture more notes from this field before you save. Okay, if probably you want to create a new order, you can also be able to just come straight to actions and create a new order. Indicate the patient, whether they were queued to your room, whether they were queued to any other room, or they are currently admitted. Okay, select the type of order that you like be done, the treatment number that you will have to assign, okay, and all other relevant information. Okay, afterwards you are going to create the order, so the patient will appear down here. You can proceed to select the patient. When it comes to the dialysis checklist, make sure that everything is indicated or everything has been done, because these are very serious cases. You wouldn't want anything to be missed out. Okay, so you indicate, and then someone will indicate if it was done or not done. All right, and then of course we have the markers connected. Of course, this is if you connect the dialysis machine, then you can mark it as connected. If you disconnect it, you can mark as disconnected. If the entire thing has already been completed, you can mark as completed. If you want to make a lab request directly from dialysis, you can be able to do that. Prescriptions, giving diagnoses, scheduling appointments, accessing the patient's bill, and of course the system should generate for you a very comprehensive dialysis flowchart. Okay, a very comprehensive one, depending on everything that you have indicated while this patient, while you are attending to this patient. And if probably you want to cancel the whole dialysis order, you can also be able to cancel it from here. So that's the dialysis module. Next, I would like to touch on special clinics. So if you're a healthcare facility and you have any clinic, be it NC, be it MCH, be it oncology, urology, or any other type of clinic, we are able to configure it or customize it according to your liking. Okay, so it can be found under the clinical module, special clinics. From here, you'll be able to see all the clinics that you like to have. Okay, so they usually don't come pre-configured. You have to tell us what you wish to be on that particular clinic field, so that we're able to design it in that manner. So for instance, if I were to select MCH, as you can see, we can be able to configure something very comprehensive according to your liking. Okay, it will also be bound to its own room. Okay, so you'll be able to record all your data here. Afterwards, you're going to save, and of course this report will generate for you a special clinic summary. at the end of the month or at the end of the day, you should be able to see how many patients have you been able to see for that particular time range. Okay, so that's the special clinic feature. Now let's dive into the procurement module in MedicentreV3. So this is where hospitals manage the entire purchasing life cycle, from supplier registration all the way to payment processing. The goal of this module is very simple. It aims to eliminate paperwork, to stop stock losses, and ensure that every shilling that you spend is properly tracked. To access the module, you just come to the procurement module here. Okay, but of course you need to have selected it from the pricing app so that it appears here. Under it comes multiple sub-modules, for instance the suppliers, where you're able to see all the list of all your vendors, okay, and as well as their details, the telephone numbers, the contact person, the physical address. Should you wish to change anything, you can be able to change and of course update the changes. Should you wish to deactivate the supplier or delete the supplier completely, that's something that the system can allow, okay, depending on whether you have the privilege to do so or not. And then we have the purchase requisition notes. For the purchase requisition notes, this is now an internal request that's raised by a department when they need to purchase something. Okay, so it may be the pharmacy department, it may be the clinical department, or any other department. So they'll have to select a storage location from here. Okay, so this is now the requesting location. Okay, and then afterwards they're going to save that PRN, after which they're going to select it, and then they're going to enter all the items that they wish to have procured. Okay, after listing all the items with their respective quantities, the purchase requisition note will have to be authorized by their HOD. After authorization, a purchase order will have to be generated by the procurement officer. So this will transition the PRN to no longer be a PRN but a purchase order. Okay, so the procurement officer will have to generate a purchase order for every requisition that has been made by each department. After the requisition note has been authorized and then has now transited to be now an LPO, the LPO can now be found here under purchase orders. Okay, so to access purchase orders, just select purchase orders. You're going to see all the purchase orders that have been created. All right, so if probably you can't see your purchase order, you can also be able to backdate from here. Just backdate. So you'll be able to see all purchase orders that have been generated so far. Select the purchase order, and then on the actions tab you can come to purchase order items. So this purchase order will show all the items that were in the requisition note. If the procurement officer wishes to change anything from that list, then they can be able to change. If they wish to add more items, then they can also be able to add more items from the list and add. Okay, afterwards the LPO has to go through some verification processes and approval processes. It will have to be marked as checked by the procurement officer, confirming that everything that is in that purchase order is correct. Okay, the accountant will have to have a look at the LPO and see if the cost is something that they have budgeted for. If that's the case, then it will have to be approved. After approval, it will have to be authorized by the administrator. Okay, so all of those approval levels will be shown here. You'll be able to see who checked it, who approved it, and who authorized it. And of course, each approval level will come with its own color coding. All right, even if you wish to filter checked only, approved only, or authorized only, the system will also allow you to do this. Okay. After the purchase order has already gone through all of these approval levels and the items have already been received, then we transition to the goods received note. In the goods received note, the procurement officer will indicate the invoice number of that invoice as well as the delivery note number, okay, and we'll be able to link it to the purchase order that was created. Okay, so it will show all the items that were supposed to be received. So we can find a GRN from here. So let's say this. In the GRN items, the GRN should show all the items that were in that purchase order. The procurement officer will go item by item, changing the expiry dates, entering the batch number, and of course, if probably you want to enter the correct unit price, a new unit price for that particular product, then they can adjust the unit price. Okay, they can also be able to adjust the unit cost, probably if you bought it at a different price than what's indicated here. And then in the quantity received section, if you have received less than what you had ordered, you're able to adjust here before you update the changes. The system also allows you to receive items in terms of donation, because it's something that usually happens. Probably you have received something in terms of donation, so you can just indicate that particular item or the quantity as bonus, all right, before you update the changes. So that will make sure that the amount translates to 0. Okay, but in essence, yes, you will receive the items in stock. Okay, so after adjusting the expiry date and the batch number of each particular item that is in this GRN, it will also have to pass through some approval levels. The GRN will have to be marked as checked, it will have to be approved, and it will have to be received and committed to stock. This one is very important because we would like to make sure that there are no errors in the GRN before they are received. Otherwise, you may have cases whereby you need to return some items back to the supplier, which can also be done through the credit note, but you have to ensure that every verification process is done by the correct person and done very carefully. Okay, so once you have received and committed the GRN to stock, it will automatically update the inventory. Okay, so your inventory levels will increase, and of course it should create a supplier bill that now will need to be paid by the accountant. So you can say that the procurement officer work will end in the GRN, and for the accountant it will now begin from the supplier bills, because now an invoice will be generated. Okay, an invoice will be generated. So let's just look for any example of an invoice. So let's assume it's this one for 90,000 shillings. A voucher will have to be generated as well, because you cannot proceed to pay without the voucher being approved, before the voucher being created and then approved and authorized. Okay, so it will have to be created, approved, before now you come to select the payment mode that you wish to make the payment, so that you can cater for that bill. Finally, we have the supplier prepayments. So these are advance payments that you make to a supplier before goods or services have been delivered. So to create a supplier prepayment, you just proceed to the procurement module, enter the supplier. From there, the payment mode, the payment mode, reference, what do you want to pay them for? Okay, enter the name of the person who is making the payment, and then the prepayment amount. Okay, yeah, so this is how the procurement module aims to to make sure that you don't lose your stock, especially when you're procuring these items. And also, the procurement module has its own set of reports. Okay, the supplier aging schedules, the pending supplier bills, all of that, which will also be shown to you in later in the video. Okay, so the beauty of the procurement workflow is that everything is integrated. A purchase requisition note will lead to a purchase order. The purchase order will lead to a GRN. The GRN will lead to a bill, and the bill will need a payment voucher. So every step is controlled, approved, and fully traceable, which protects the hospital from fraud, stock losses, and unverified spending. So that's the procurement module in a nutshell. Next, let's take a look at the inventory module in MedicentreV3. This is one of the most important modules in any healthcare facility because it helps you to control your stock, to prevent stock losses, and maintain accurate visibility across all your stores. So to access the inventory module, you can either click on the shortcut here on the home page, or you can come to the inventory module, inventory. The system will prompt you to select a storage location. This is because every storage location, or every department have some items that are primarily stored in that particular location. So let's select the pharmacy storage location, for instance. So this is how the inventory module or the inventory panel looks like. Okay, if you wish to add a new drug, you can be able to add a new drug from here. Enter the unit cost, enter the unit price, enter the minimum unit price so that whenever a discount is given, it can never go below this price. Okay, the total quantity of all your items, and of course the reorder levels. For the reorder levels, each item in the system will be assigned a reorder level so that you never run out of critical supplies. So once stock drops below the set level, the system will trigger an alert notification, which will now allow the procurement team to act early so as to prevent stockouts and ensuring smooth operations. So if you want to view the list of all the products that you have in your storage location, you just scroll down to the bottom of your panel and you view. So the system will show you all your active products, as you can see, and their batch number, their buying prices, and their selling prices, the total number of items that you have in stock, and of course the expiry date of each item. If you wish to adjust an item, you can be able to adjust an item from here and you update the changes. Okay, I was speaking about the reorder level. So for instance, if it's 50% dextrose and it goes below 50, the system will alert certain users that some items are below their levels and they need to be procured early. Okay, the system will also alert you when it comes to expired products. The system will show you the list of all your expired products in terms of a report, as well as items that are near expiry. Yes, so it will always keep you in the know. Moreover, we have the internal order feature. For the internal orders, of course, here requests are placed from one department to the store or probably the pharmacy when they need items for their daily operations. So instead of verbal requests or small papers or manual papers that can get lost, the system has ensured that you are able to track every internal request digitally. So to make an internal order, you just come here in the requesting location. Who is requesting? Probably it's the nursing station. The issuing location, probably I want some things from the pharmacy. Okay, you can indicate some comments so that the person in the other location can understand your needs better, and then you can save. After you save, your internal order will appear down below, after which you're going to select, and in the order items you're going to see all the items that are in the issuing location. If you were to select an item, the system will show you how many items are in the issuing location and how many items are in your location, and then you can proceed to enter the number of items that you wish, probably 100, and then you save. So you do this for all the items that you wish to request. Afterwards, after you're done, the request will have to be approved and sent. The person in the issuing location will get a notification that an internal request has been made from nursing station or whichever location. Now for them, they're going to come to this filter and search for not dispatched, because they have not yet dispatched it. They're going to select your order and view the order. Okay, so they're going to see a list of all the items that you're requesting for, and then if they wish to adjust the items, they can adjust the items that they wish to issue. If they don't, if they want to continue like that, then they can just proceed to dispatch. After dispatching, the items will need to be received. It's very important for the items to be received because if not, the items won't be reduced from the issuing location into your location. So you have to make sure that you come to the not received filter, select your internal order and receive. In the back end of the system will show that items were removed from one storage location and increased in another storage location. Okay, for inter-branch orders, this is probably if you have an organization that has multiple facilities or branches, then this feature will make it easy for you to transfer stock between locations. So one branch can request items from another, and even movement is recorded. Okay, so the importance of this is it supports centralized control while giving individual branches flexibility. Okay, so this means that branch A can order branch A can order from branch B. Okay, branch A can order from branch B. So sorry about that. So you have to select the other branch. So the system should show all the items that are in that other branch, in that storage location, and then it will show you how many items there are, how much they bought that particular item, and of course the unit price. Okay, if they usually sell it or not, and then you can enter how many items you wish to order. Afterwards, you'll approve, you'll send the order, you'll approve the order will be dispatched, and you're going to receive the order. Okay, for material consumption, this will record every item that leaves the store and is used for patient care or hospital operations. Okay, so this will protect your hospital from those silent losses, because every item or every gram or every unit consumed should be accounted for. Okay, so for instance, if I'm in the nursing station, okay, and I've used some gloves and I need these items to be reduced from stock, I just select my storage location and I enter the item that I wish to be reduced from stock. Of course, the system will show me the quantity that I have in stock, and I enter how many items I have consumed, what were they used for. This has to be clearly explained, okay, before you save. Alright, so you can do this for all your items, and once you're done, you're going to commit the material consumption to stock. Lastly, we have the stock take. Stock take ensures that the physical count of items match what is in the system. Alright, so in MedicentreV3 you're able to do a stock take for multiple storage locations. Okay, so you just come here and create a new stock take. Okay, select the stock tick, and then you're going to load all your products. So the system will show you all your products and the system quantities. Okay, so you're just going to adjust the quantities from here. If you wish to adjust more than the quantity, you can click on this pencil at the farthest right, where you can be able to adjust the unit of measure, the expiry date, the batch number before you save the adjustment. Okay, so if any discrepancies arise, the system will highlight them in terms of the variance report, so that they can be investigated and corrected immediately. Okay, so it's also very important for any facility to do stock takes regularly to avoid cases of stock discrepancies. Now let's move into the accounting module of MedicentreV3. This is the financial backbone of the system, built to give healthcare facilities complete visibility and strong internal controls across all financial operations. So to access the accounting module, you just come to accounts, and these are all the submodules that are under accounting. We'll begin with fiscal periods. For fiscal periods, they allow the financial team or the accounting team to define their financial year and control when transactions can be posted. Okay, so this will protect your books from unauthorized entries and ensure that all reporting aligns with the correct accounting period. So this is where you're going to set your opening date and closing date for your fiscal year. Okay, of course you can only have one active fiscal period at a time, and of course the others can remain open until when you're satisfied for them to be closed. But you can only have one active fiscal period where all transactions will go through once they are posted, either in the bill inside or whether it's journal vouchers or yeah. Next we have the ledger accounts. So for the ledger accounts, it allows you to configure your accounts and sub-accounts. So for every financial transaction in MedicentreV3, all of those transactions are mapped to an account. Okay, so these accounts here will form your chart of accounts, and it will make it possible for you to generate accurate financial statements like the balance sheet, the income statement, and trial balance. So it ensures that every shilling is categorized correctly. All right, so it's for you, the accountant, to know what can be included as an account payable, account receivable, or any other type of account that you wish to be configured in the system. We have the payment modes. So this is what you as a facility can accept as a means of payment or can use as a means of payment. Okay, so payment modes enable you to standardize collections, and it also make reconciliation straightforward for the financial team. Okay, for the banks, this section will allow you to register all your bank accounts in the system. It will also enable you to monitor their balances, okay, and link them to transactions. So all the bank accounts that you have as a facility need to be included here, because at the end of the day, once you're doing your bank reconciliation, you'll need to see the transactions that went into each bank so that you're able to reconcile these transactions easily. So it provides a centralized view of being able to see all your bank accounts at a glance, as well as the account numbers and any other detail that you may want to see. For the schemes, these are the insurance companies or corporate accounts and any other partner organizations that the hospital bills. Okay, so MedicentreV3 will allow you to configure their pricing, okay, and even payment arrangements. So you can be able to see all the insurance schemes that we have here. You can be able to set inpatient limits, outpatient limits, you can be able to state whether any scheme here needs co-payment. Okay, so all of that can be done, and of course if you have some insurance that uses smarts, you can tick them that they use the smart card. All right, and of course we have the scheme items. So for the scheme items, this is used to define exactly what each scheme covers and at what rate. Okay, whether it's a consultation service, whether it's a drug, a lab test, a procedure, or any other thing, it ensures that the correct price is applied automatically during billing. So different insurance schemes can have different prices, okay, for products and for services. Whether you want to apply markups or whether you just want to put a random number for pricing, then you can be able to do that from the scheme items field. You can be able to state if you don't want something to be covered under any insurance scheme. Okay, when we talk about cashier shifts, this will enable you to track who collected money, when they collected it, and how much they collected. Okay, so this improves and it provides airtight revenue accountability, so eliminating common loopholes that probably you may be having where funds just disappear without a trace. So for instance, using this example of Abel, I'm able to see all the shift receipts that Abel has collected during the shift. At the end of the day, or at the end of the shift, they're supposed to end their shift, and of course the system will provide this report, the cashier shift summary report, which will show if there's a balance or if there's a difference between what the cashier was expected to end the shift with and what they actually ended with. Okay, so it's very, very useful to ensure that there are no cases of revenue leakage. Moving on to journal vouchers, this allows accountants to make manual adjustments in the ledger when needed. Okay, if you want to correct any account or any sub-account, probably accruals and adjustments for depreciations or provisions, that can be done through the journal vouchers. It gives accountants financial full control over their books. Okay, we have taxes. So this section manages VAT or any other tax configurations that billing and reporting will align with the regulatory requirements. Okay, what are the types of taxes that you have as a facility? Do you have withholding tax? Do you have VAT exempt, reduced or zero VAT, or all of that? So all of that can be configured under taxes. Next, let's look at cash transfers. So for cash transfers, it will track the movement of funds internally. So for example, from the cashier to the finance, or from one account to another. So ensuring that nothing is moved without proper documentation. So you can select, the system will show all your cash accounts and of course their current balances and where you want to transfer the money to. Okay, you can give a brief description, the amount. You have to also list the amount in words so that you're sure of what of the amount that you want to transfer, who is going to receive this money, and then you're going to transfer the amount. All right, so then we have bank deposits. So for bank deposits, this will enable you to record when cash collected is deposited into the bank. So it will create a clear audit trail from point of collection to final deposit. So ideally, when a cashier shift is ended, the amount that amount may be transferred to the safe deposit box, and then the accountant may decide to take that money from the safe deposit box and deposit to the bank. Okay, so that will be the essence. That will be the essence of the bank deposits feature. Next is checks. So MedicentreV3 will track issued and received checks, their status, their due dates, and clearance information. So you as an accountant, you're able to write a check directly through the system. Okay, so every check that you indicate here, of course, it will always remain in the system, which means that the system will help you to prevent cases such as lost checks, and it will also support proper follow-up. Okay, so you can easily write a check here using any bank account that you wish, give a brief description and reference, and then select which account this amount should go to, okay, before you post. So of course, after doing this, your bank will be debited by that amount. We then move to bank reconciliation. So this feature matches your system transactions against your actual bank statements. At the end of the day, you're going to create a bank reconciliation, and of course you need to have an opening balance and a closing balance. So the system, as long as you have been using the system, it will show you all the transactions that you have used for that particular bank. Okay, and of course on the other hand, you're going to have your bank statement that you'll refer to. So it will ensure that your books will reflect reality and highlight discrepancies like missing entries or bank charges. So you're able to adjust the reconciliation, whether it's adding to book or adding to book or lessing from book. When we talk about clearing and forwarding entries, so all of that will be done from bank reconciliation. For currency units, this is probably if you deal with multiple currencies, or let's say not currencies, let's say the units, because this is what the cashier will end the shift with at the end of the shift. So probably if you're using a currency that has only a 20 shilling note, a 30 shilling note. In Kenya we have the 1,000 shilling note, the 500. So this is what the cashier will indicate at the end of the shift, that these are the amounts that they have collected at the end of the shift before they close. Now to asset management. MedicentreV3 will allow you to record, to track, to depreciate, and monitor all your hospital assets. So from beds and equipment to buildings and vehicles to any other assets you may be having, if it's your ambulance, if it's your lab machines, your radiology machines. So this will help to improve accountability and support long-term planning and audits. So the system will show you the salvage value of each item, because you'll be doing depreciation runs regularly, so as to be able to see the current value of your item. Okay, next is budgeting. So budgeting allows the management to allocate planned expenditure across departments and to monitor performance against the budget. Okay, so here, if I could just show you an example, the system should show all the sub accounts that you have as a facility. Okay, so you can be able to budget for each sub account separately. All right, and afterwards you're going to save the budget. As you continue to use the system should provide an actual report, all right, or a report that shows the variance in between the budget and the actual report. So what's the difference between what you had budgeted for and what you're currently using? Okay, all right, then we have capitations. So this will allow you as a facility to receive fixed payments from insurance schemes or insurers. So depending on the insurance schemes that we have in the system. So it will help you to keep track of how much capitation you have received, how much you have used, of course the beginning and the end date. You should be able to see all the invoices of that particular scheme that have been generated within this period, to which now you can decide to process or even write off. And of course, once you write off, the system will prompt you to select the sub account that should be affected by the write off. And then we have the opening balances. For the opening balances, this will now be used to set how much money you currently have before you even begin using the system. So if you're currently using another system and you transition to MedicentreV3, we'll need to enter the opening balance, which probably will now be the closing balance of your previous system. So we list it as the opening balance. So whenever transactions are done through MediCenter, it will start to pick from that opening balance onward. Okay, so you can choose whether it's a supplier balance, whether it's the bank balance, cash balance. So there are multiple options to choose from. Okay, so that's the accounting bit. So let's move now to the human resource module. This module will bring together all the HR functions into one centralized place, ensuring that hospitals manage their staff efficiently while ensuring compliance with labor and tax regulations. We'll begin with consultants. Here, the organization can register external specialists or visiting doctors who operate on a contract basis. So you can easily add a consultant from here, and you save them. They'll appear on this list down here. So by selecting any consultant, you're able to track all their sessions, procedures, and payouts, okay, and even configure the individual deductibles. Okay, how much are they supposed to be taxed? How much is the hospital going to take, and how much is the consultant going to take at the end of the day? All right. Of course, once you create the consultant bill, from here you'll be able to see all the procedures, all the sessions, and all the payouts that have been done by different patients to this particular consultant. So afterwards, you can be able to create a bill, all right? And of course, a voucher will have to be approved, and of course, it will have to be authorized before the bill is paid. Okay. So this ensures that the consultant fees remain accurate and transparent, and of course the system still entails reports for your consultants. Okay, how much do you owe them? And of course, now let's move to employees. So this section will hold the complete employee database for the hospital. It includes personal details, the job roles, the departments, the employee status, and salary information. It forms the foundation for payroll, attendance tracking, and performance oversight. Okay, so your employees will have to be entered into this list. Of course, we have the employee portal, so they can also be able to access the employee portal, whereby they can request for leaves, they can request for salary advance, they can be able to view their own pay slips. Okay, once you select an employee, you'll be able to see all the details that you as the HR filled last time. You can also be able to edit or adjust anything, okay, from here, and you update the changes. Next, let's look at pay periods. So pay periods define the hospital's salary cycle, whether monthly, whether it's weekly, or custom. Okay, so by setting these periods, the system already knows when exactly to process the payroll and lock records to prevent late alterations. Okay, so if you want to create the payroll for January 2026, you just enter the year here, 2026, the month that you wish to pay, and then the beginning and the end date, of which you can adjust, and then you can tick is the current pay period, meaning that whenever you generate the payroll, they will only go to this particular month, this particular pay period. Okay, yes. Next, let's move to payroll parameters. So these parameters define the allowances, deductibles, benefits, overtime rules, and statutory contributions that shape each employee's pay. It ensures payroll calculators are standardized, accurate, and compliant with the organization's policies. So here you're going to have all your parameters listed, whether it's overtime, any other deductibles, or any other allowance. It does not matter. So all of them are going to be listed here. Of course, the system will come configured with the necessary ones: SHIF, NSSF, and of course the system will enable you not to worry so much about calculation of SHIF or NSSF, because the system will automatically be computing by itself. All right. So for you as the HR, you only need to make sure that the allowances are correct for each employee, the deductibles are correct for each employee, and then the system will generate for you a very comprehensive payslip. Next, we have the pay tax ranges. So this section maintains the official tax brackets used in calculating pay each month. So by automating tax ranges, the system ensures that every payslip aligns with government requirements without manual intervention. So these are how the tax ranges are configured. So you can be able to enter a lower limit and an upper limit, and then to enter the tax rate, and then you can save. If you want to update, you can just select on any, and then you can change any detail that you wish, and then you update the changes. Now let's talk about salary advance. So the system supports control processing of salary advances for employees who need funds mid-period. So every advance is logged and automatically deducted from the next payroll cycle to maintain financial discipline. So whenever an employee has requested for a salary advance, of course they have to indicate, of course you can select which employee has requested for the advance, the amount that has been requested, what's the purpose of this allocated funds, from which month are they expected to pay. All right, and then if you say that they will clear the whole amount at the next period, then the whole amount will be deducted from the payslip the next period. But if you say it will be cleared partially, and then you enter how many months that this amount will be cleared, the system will know how to compute that amount is divided equally between those months, and it will appear on that particular employee's payslip. Okay, so of course, as you can see, the salary advance still has its own approval levels. It can be approved by the HR, it can be rejected, it can be disbursed. You can be able to view all your payments, and you can also cancel the request entirely. Then we have payslips. So once the payroll is processed, the system will generate detailed payslips for each employee, showing earnings, deductions, taxes, and the net pay. So if I were to select any employee and view the payslip, so this is just an example of how the payslip will look. It will have your logo, it will have the details of your facility, it will have the details of the employee, okay, and the earnings, the deductions, the tax relief, everything, and of course even the employer contributions. The system is able to compute by itself. All right. So, and of course you can see the net pay of that particular employee. You can be able to print it, you can be able to share it via email, and as I had indicated earlier, they will have an employee portal where they can be able to see or print their own pay slips. Next is leaves. So for leaves, it enables you to manage all forms of leaves, okay, that you may be having as a facility, whether it's annual leave, sick leave, maternity, compassionate, off days. So for leaves to be configured, you just come here on the Actions tab. You can be able to create a leave request from here for any employee that you wish. Okay, indicate the date that they wish to take their leave and the date that they intend to return to work, and then you submit. Okay, and then we have the different leave types which can be configured separately for each facility depending on what you have, and you can allocate the number of days that each leave has. Okay, of course, once an employer has requested for a leave, the system will know how much is remaining for them to request again next time. We have the pending leave request, whereby you are able to see all the pending leave requests for approval, and of course, if you're a facility and it needs also the admin to approve, then the admin can also do the approval, or you can reject. Okay, so once you approve the leave request, the employee on the other end should get a notification that their leave request has been approved or their leave request has been rejected. You can as well configure the holidays that you have as a facility. Next, let's look at scheduling. So scheduling allows HR or departmental heads to create duty rosters for staff, especially in shift-based environments like nursing, pharmacy, radiology, lab. So it ensures that every shift is covered and gives visibility into who is working when, reducing conflicts and understaffing. So you can state for any date, if probably it's today, and it's nursing that you want to allocate, the system should show all the nurses that are available. So you can be able to select the nurses, okay, that you wish to do, who you wish to be on the schedule for this particular time, and then you can schedule. All right, so it will show here that these are the nurses that are available. These are the nurses that are available for this particular shift. Okay, if for any date that you wish to schedule. And finally, we have attendances. So attendance tracking will enable you to record the check-in and the check-out, and of course the lateness of each employee. So it ensures that even the payroll will reflect actual time worked and supports performance monitoring. It also helps to identify employees who are absent most of the time, so that it does not become a problem later on. So overall, the human resource module will enable your facility to bring structure, transparency, and efficiency to workforce management. Let's take a moment to look at the security module in MedicentreV3. This is one of the most crucial parts of the system because it determines exactly who can access what, and it protects the hospital from unauthorized actions, data breaches, and accidental misuse. We'll start with the user roles. So the user roles just define the different job categories in the system, such as administrator, reception, cashier, pharmacist, and any other role that you may be having as a facility. So by assigning a role, the hospital ensures that every staff member only sees the module and tasks that are relevant to their job. Okay, of course, the system aims to protect sensitive data and maintain operational discipline. Okay, next we have privileges. So privileges go deeper by defining the specific actions that each role is allowed to perform. So for example, if I select the reception role, on my left hand side, these are the things that she's allowed to do, and then on my right, these are the things that she's not allowed to do. If you wish to assign, you can just select any role that you wish. You can also search, and then you can assign using this button here. If you wish to remove any privilege, you can just select you can just select the privilege that she has, and then you can remove using the using this button here. So privileges will allow the facility to fine-tune access and make sure that no one has unnecessary powers. So this reduces errors, eliminates loopholes, and creates a clear trail of accountability. Next, we have system users. So these are the actual staff accounts created in the HMIS. All right. So from here, you're able to see all users who are allowed to access the system. Okay, you can be able to add any user from here, and then you can assign to them a password, and then you can also assign to them a role. Which role are they supposed to do? And then can they log from anywhere? Are they an employee? Do they have limited logon attempts? Which branches are they allowed to access? And then you can save. Should any of the users here be terminated from your facility, then you can just select them and click is disabled and block them from accessing the system anywhere that they may be. Okay, so their activity is tracked within the system. So every action is traceable back to a specific individual because we have the audit trail. Okay, we have the audit trail that tracks how each user has been using the system. So this ensures full transparency and prevents shared logins, which are a major compliance and security risk. Okay, so together, all of these features here, the user roles, the privilege, and the system users form the security backbone of MedicentreV3. This safeguard patient information, protect financial data, and ensure that every staff member operates within their responsibility level. It's one of the major reasons hospitals using MedicentreV3 enjoy strong internal controls and clean, auditable records. Now let's take a look at the communication module in MedicentreV3. So this module helps hospitals stay connected with patients and staff through fast, automated, and reliable messaging. Okay. For this feature to work properly, however, you may need to have an SMS provider, okay, with whom you're now going to discuss terms. How much are they going to charge you to send to different networks? After coming to an agreement, then they're going to share the API key with us for integration. Okay, and then you're now able to send messages directly to your patients. So we'll start with SMS. The SMS feature allows the hospital to send a message directly from the system. So this can include appointment reminders, clinic schedules, or any other custom notification that your facility may need. So you can just type your message directly from here. We also have placeholders that you can be able to drag and drop. Okay, so the system already will automatically pick, for instance, the patient name, for instance, the outpatient number, the residence. Okay, so you can just draft a message using the placeholders. Okay, and you can be able to send your message. So there's also a lot that you can be able to do from here. If you want to send SMSs to patients who are from a given town, or who are using a certain insurance card, or who are attending a certain clinic, okay, you can just do that from here, and you can just backdate, okay, from what time range will you want to see the patients who have come to your facility, and then you can filter. So the system should show you all the patients from here, and then you can select which patients you would like to send the message to. Alright, or you can select all of them and push them to this other side. Okay, draft your message and send. You can also be able to create SMS groups from here. You can give a group name and a description. So whenever you want to send SMSs to a certain group, you can just come and view all the SMS groups that you have, and you can be able to send the message directly without having to come and filter again. Next, we have SMS templates. So SMS templates help standardize the messages sent out by the hospital. So instead of typing the same message repeatedly, you as a facility can create reusable templates for things like appointment confirmations, uh, medical readiness, overdue balances, patient registration, all right, all of that. Even the system is able to send SMSs upon visit start, okay, upon visit end, upon lab submission of results, yeah, upon discharge. All of that is possible with this particular feature. So together they make communication faster, more efficient, and fully integrated with daily operations. Let's move into the reports module in MedicentreV3. This is where all the data captured across the hospital comes together so that it provides real insights, visibility, and control. So every department, from clinical to finance, are going to get a real-time reporting to support better decision making, accountability, and smooth operations. So to access the reports module, you can click on this shortcut, or you can come on reports and enter your password, and then you can authenticate. So it will bring you to the reports dashboard. Okay, so if you're a facility with multiple branches, you're able to see which branch has received the most patients for the day, the visits by gender, which genders the portion of the gender. If the portion of the gender that you've received today, probably you've received more males than females. The fast moving items will all be there, as well as the registration by branch. So on the reports module, we have multiple reports, as you can see, from clinical to revenue to accounting, procurement, inventory, dialysis, security, all of them. So we're going to begin with the clinical reports. So these are going to cover all the outpatient and inpatient activities. Okay, all of them are going to be here, as well as all the MOH reports are going to be indicated here. If you're a lab tech and you want the lab reports, if you're a radiologist and you want the radiology reports, all of them will be included here. You can also be able to see how many patients have been able to attend a certain clinic, how many patients have been seen by a particular role, if it's a doctor or if it's a nurse. Okay, the hypertension register, all of them will be included there. So this will help clinicians and administrators to understand the patient flow, the workload, and medical patterns across the facility. Next, we have the ophthalmic reports. So these are specialized reports for eye clinics. Okay, so tracking procedures, diagnostics, refraction results, and patient outcomes. So they will help facilities to monitor efficiency and identify areas that need improvements. We have the revenue reports. So this will provide a clear breakdown of all income that has been generated, whether it's a service, whether it's if you wanted to see the revenue for each department, insurance scheme, all the receipts that have been generated if it were cash payer, and of course you just have to give it a time period and then you view. The system will generate for you a very comprehensive revenue report. So this will help the management to identify strong and weak revenue areas, and you can also be able to catch leakages early. We have the account reports. So this will include the trial balance. It will also include the income statements, the balance sheet, the cash flow statements, the ledger sub-account history, the general ledger. You want to see how each account is performing. So this will ensure that your finance remains clean. You're able to track everything in real time. you're able to maintain clean books and support compliance with accounting standards. Okay. Next we have asset management. So this shows the asset registers. Okay, depreciation schedules, maintenance needs, equipment valuations. So they will help the hospital to track and manage assets throughout their life cycle. Next, we have the budgeting reports. So the budget reports will compare planned budgets against actual reporting. So they help management to control overspending and monitor departmental financial discipline. Let's talk about receivable reports. So this will track all the outstanding amounts that are owed by insurance schemes, corporates, and private patients. So they support follow-ups, reduce bad debt, and overall improve the cash flow of your facility. Next is procurement reports. So this will give you full visibility into your purchase requests, orders, deliveries, supplier performance, the pending supplier bills that you have, the pending consultant bills that you have, the settled consultant bills, expenditure trends. So they aim to help identify delays, inefficiencies, and stock risks. Then we have inventory reports. Inventory reports track stock levels in each storage location. Okay, they help to identify consumption trends, expiries, consumption of items, pilferage risks. That means how close are you to losing your stock, movement across different locations. So they aim to maintain optimal stock levels and eliminate waste, and also help to make sure that you're able to track all your inventory items at a click of a button. Now let's take a look at theater reports. So this shows surgeries performed. Okay, all the surgeries that have been performed by a particular surgeon over a given time at your facility will be indicated here. You just have to give it a time range and you view, so you'll see all the operations that have been done. Next, we have the queue management reports. This will show the patient's wait times, service durations, and congestion patterns. So from here, you're able to see which room are patients staying longer than the other. Okay, so they help to improve workflow, reduce bottlenecks, and enhance patient experience. Then we have HR reports. For HR reports, this will cover attendance, shift, leave balances, payroll summaries, and even staff performance indicators. If you wish to print a monthly payroll summary and take it to the bank for processing, that can also be done from here. So they help the human resource team to plan manpower and maintain compliance. Okay, and then next we have the morgue reports. So this will enable you to track the admissions as well as the releases, the storage duration, and client details. So they support proper documentation and operational transparency. Next, we have maternity reports, which will include ANC, delivery summaries, mother and baby records, and all of those information that you may deem necessary about maternal mothers. So they will help to support clinical audits and compliance with the regulatory standards. Next, we have dialysis reports. So this shows session histories, okay, patient progress, machine utilization, consumable usage, and treatment outcomes. They'll help to maintain quality care and accurate billing. Next is security reports. So this will enable you as the administration to track each user activity, login history, privilege usage, and access patterns. So it aims to enhance accountability and support audit compliance. Finally, we have comparison reports. For comparison reports, it allows the management to compare performance across different time ranges. Okay, how well did you perform today than yesterday? How well did you perform this week than last week? Your daily revenue versus your expenses, your yearly revenue versus expenses. Okay, even the clinical reports can be shown from here. Which day did you receive more admissions than the other? So you can be able to compare a lot of outcomes from here. And then we have the business intelligence, or BI. So this is a visual analytics dashboard that transforms raw data into clear charts, metrics, and insights. Okay, so when it comes to healthcare dashboards, financial, inventory, procurement, all of them has its own separate dashboard. So it enables you as the administrator to see everything at a glance, how you're operating as a facility. Okay, and from this, now you're able to make fast and data-driven decisions using real-time dashboards and advanced analysis. So overall, the reports module is one of the most powerful parts of MedicentreV3. It stands and ensures that every transaction has its own actionable insights, therefore driving efficiency, accountability, and smarter decision making across the entire hospital. Now let's move to the learning management system, or the LMS. So this system was designed to support continuous training within the hospital and make sure that your staff stay updated on processes, protocols, and of course system changes without needing physical sessions every time. This is the primary tool that will be used to onboard new clients. Okay, should you decide to take on the system. So this is the access page, this is the login page, from where now each of the users will be able to sign in to their respective facilities. So upon logging in, the system will redirect them to the learning dashboard. Okay, so each user will have their own roles and of course their own set of learning materials to go through. So in the learning dashboard, the videos are going to be arranged in a systematic order according to what they need to learn first before they proceed to the next video. So all the training content will be in one convenient place. Administrators and department heads can be able to upload learning materials, whether it's videos, documents, manuals, or even step-by-step guides. So it will make onboarding very easy for new staff, and of course it will ensure that everyone understands how to use the system and follow the facility standards. Of course, as I had indicated, the videos are going to be arranged in a very systematic order. So once you click a video, it will begin to play, and of course from here you're even able to take an assessment so that you can gauge yourself. You can gauge your level of understanding. The system of course is going to compute if you have failed or if you have passed. If you have failed, then you may need to redo the assessment. Of course, it will have another set of questions apart from this. If you have passed, the system will now unlock the next video for you to watch, and the same process will go over and over again. The administrator the LMS administrator will be able to look at all the learners' progress, what they were supposed to learn, how far they have learned. Okay, so the good thing about this is you can be able to log in at any time to access the course or the role that you have been assigned. You can learn at your own pace. You can be able to revisit the materials when needed, and you can stay aligned with the hospital workflows. So the LMS will also ensure that we reduce the common challenge whereby even if you have new staff, they depend entirely on colleagues to explain operations. So that won't be the case anymore. All right, everything they need is well documented and always available. So as long as they have the credentials to access the LMS, they can be able to learn at their own pace. So the system will be able to track the training progress as well, as I indicated. So in the learner management, you're able to see all the users, all the LMS users here, and of course the progress that they have on each module. You can be able to see if they have done an assessment or if they have passed or not. If it's a learning path that is still in progress and the assessment has not yet been done, you can also add a review, okay, and you can submit it, which will be visible to that user. You can also be able to send reminders, okay, via email. So they're going to receive email reminders that they should continue learning, and of course, yeah, they should continue learning. So from here, the management can also see what is pending, and of course, which staff or which user may need additional support. So it also helps to maintain uniform skills across all departments and improve overall service quality. Okay, so that is the LMS. Having already given you a thorough walkthrough of MedicentreV3 and the learning management system, I'm now going to answer the frequently asked questions. The first one being, can MedicentreV3 be integrated with other third-party platforms? So yes, this is possible. MedicentreV3 offers seamless integrations with other third-party platforms, enhancing efficiency and connectivity. So some of the integrations that we offer include SMS, DICOM, integration for radiology machines that are DICOM enabled, M-Pesa integration, smart integration, lab integration for hematology and urinalysis machines, and of course KRA items. So you can also be able to generate items compliant invoices and receipts should you wish to take on the integration. And of course, we are currently in the process of being integrated with SHA. The second question, does the system support multiple branches? Yes, MedicentreV3 supports multi-location healthcare facilities, as you can see from here. So it enables you to have a centralized management of all branches with real-time data and synchronization. Okay, so you're able to see how all your branches are doing, regardless of where you are or which branch you currently are. Okay, so how secure is our data? So as Handmark Technologies, we take the issue of data security very seriously, with multiple enforcement measures implemented, such as end-to-end encryption, okay, role-based access, and automatic backups every 30 minutes to protect data breach and loss of data. And as you can see from here, you are also able to see everyone who attempted to log in and who are unsuccessful. And of course, the system should show the IP address of that particular machine that they were using to access the system. Furthermore, we have the audit trail reports that will show how each user has been using the system, and of course, if there have been any discrepancies as to how they have been using the system. All right. Okay, the fourth question. How do we migrate from our current system? So our team will assist you to ensure that you have a seamless migration process, ensuring that data integrity is maintained when transferring data from your current system to MedicentreV3. We are going to provide you with data templates that you are going to fill before they are imported back to the system. This, however, will not include patient's medical history. So we are not going to import the patient medical history, but any other information is going to be imported. Okay. So how do we manage user roles and permissions? So this is going to be done using role-based access, which will allow the administrator to assign specific permissions to users, ensuring that only authorized staff can be able to access sensitive data. How frequent is the system updated? Updates are done regularly by our research and development team. Okay, so as you can see from here, we have what we call the change log. So from here, whenever an update is done by the R&D, you're going to see the improvements that we have made as well as the bug fixes. You can be able to filter any change log that you wish, and so that you can be able to see what exactly did we change. Okay. All right. We head to the next question. Can MedicentreV3 be deployed on a local server? So MedicentreV3 is hosted on the Google Cloud platform, offering a guaranteed period of 99.5% during the whole month. So this eliminates the need for a local server. Okay. In certain cases, however, we can proceed with implementing the system on your local server, but you have to be on the annual plan with over 15 concurrent users selected from the quotation. Okay. How is the training done? The training will be done through the learning management system. So the LMS is going to provide structured courses, interactive modules, and video tutorials covering all aspects of the system. So with each role comes a step-by-step guide, assessment, and practical exercise so as to reinforce the user's learning. You're also going to have a dedicated support team in hand so that they can provide further clarification and ensure that you have a smooth learning experience. How do you offer support? We have multiple levels of support, but our most common is through the Handmark support portal. Okay, so to access the portal, you can access it directly from MedicentreV3. From here, you're able to search for any video that you may wish to know about, any how-to video. Okay, if you want to know how to register a patient, the system is going to give you a list of options there to choose from. Okay, if you want probably to do anything, you just type something here and the system will generate a video for you to watch. Okay. Furthermore, we have the create ticket here, whereby you can just give us a problem category. Okay, give us a problem description as to how it has affected your operations. Give us your phone number there, and you can also attach a file, and then you can submit. So we're going to get a notification on our end, and a member of our team should be able to reach out to you immediately. Yes. So the next question is, what is the cost of the system? So the cost of the system will depend on the modules that will be selected from the pricing app. Okay, so this is how the pricing app looks like. So from here, you're able to enter any module that you may wish to have. Yeah, you can be able to enter any module that you wish to have, as well as the number of concurrent users, which means the number of users who are going to access the system at any given time. The system is going to have three options: the annual subscription plan, the monthly subscription plan, and the per patient visit. So you can be able to choose the one that suits your budget. And of course, this is now what will be used to draft the contract. So that is it for me. I would like to thank you for taking your time to watch this video, and we look forward to hearing from you soon, and hopefully becoming a trusted healthcare technology solutions provider. Have a good day.